Now, the Nigerian government says it will release 9.8 billion naira for polio vaccines across the country. The 9.8 billion to be released is exclusive of the 6.5 billion naira approved by the Ministry of Finance when the polio crisis started. Minister of Health Isaac Adewale, who disclosed this at a briefing in Abuja, said the money would be used to execute the polio response plan developed by the National Primary Healthcare Development Agency and its partners.
These campaigns will be synchronized with the affected regions and provinces in Chad, Niger, Cameroon, and Central African Republic. For the sub-national campaigns, 31,540,054 children are targeted to be vaccinated each round with oral polio vaccines across states in the northeast, northwest, and central zones of the country. For the nationwide response, 56,363,618 children will be vaccinated between October and November 2016. The revised plan was informed by factors such as historical data on why polio virus affected areas, pattern of transmission over the last 5 years, population displacements due to insecurity in the northeast, likelihood of spread of the virus to other neighboring countries, and population immunity. Furthermore, the justification for the expansion of the initial schedule includes the fact that given the history of exportation to other countries and the suboptimal routine immunization coverage in several countries in the African region, the response requires that adequate protection be provided to vulnerable children at risk of infection.
While the Minister of Health has been explaining the outcome of his ministry's investigation into the two new polio cases, which has now set the country back in the fight against the disease. Here's what he's been saying.
Reports from the detailed investigation carried out by a team revealed that both cases came from security-compromised areas of Borno State, which have had limited access to any form of health services, including immunization, since 2011. The case reported in Jere local government area was from a child who had arrived at an internally displaced persons camp in Muna camp in Jere local government around Maiduguri after trekking for 2 days following the provision of an escape corridor by the military authorities. The second case was detected in Goza local government of Borno State. Both local government areas have had their health facilities destroyed by insurgents, and accessibility was a barrier to service provision. Both cases have been linked to the polio cases detected in Bama in 2011. For Nigeria, while the timely response in the affected local government areas and its environs is critical, the country needs to be proactive to ensure all eligible children are vaccinated within the shortest time feasible so as to limit the spread of the virus beyond the affected areas and the borders of this country. There remains a high risk of further spread of the virus due to population movement within and across the state. This spread is not limited to surrounding states, but will also affect neighboring countries around the Lake Chad region. So far, we have commenced immunization of children in accessible areas of Goza, Jere, Maiduguri Municipal Council, Bama, Mafa local government areas concurrently with active case search.